Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. So let's get right back into it. I'd like to introduce my third and final guest to the program. Here with me now is Ms. Carmen Gill, Hub Manager for Building Healthy Communities. Welcome, Carmen, and thank you for being here.
Thank you for having us.
Indeed. So Carmen, what is Building Healthy Communities, or BHC, as you know, folks refer to you as? And tell me what Building Healthy Communities is first.
Building Healthy Communities is a 10-year initiative of the California Endowment that is investing millions of dollars in 14 communities across the state. So we are lucky to be a chosen one of those 14. Some of our counterparts throughout the state include folks in Richmond, Del Norte, City Heights. So we're all throughout the state, and here particularly in Monterey County, we're focused around the East Salinas area.
Go ahead.
And how we connect with health in all policies is really because we are from the framework of health should be central to all of our work, and especially in our policies. And so we're pushing for systems change where our policies are actually coming from the framework of what do the residents need and what do they need to make sure that they're healthy and that they have all their basic needs to ensure a lifelong success.
Yeah, so and that's why you're here. That's how you that's how Building Healthy Communities is involved in this discussion, because you are there in the community already.
Right.
And the partnership there between Building Healthy Communities and the Health Department is great, because you're already in the community doing many of the actions that, you know, we are setting in motion. Am I saying that correctly?
Correct.
Go ahead.
So, right. So the reason why the partnership is important is, again, like I said, because our framework really comes from ensuring that we have our residents' health and well-being at the center of everything that our communities are doing.
Okay.
So that's where that tie comes into what the health department is actually doing right now.
Yeah, and so why is health in all policies important for Building Healthy Communities East Salinas, specifically that community?
Well, because we know some of the obstacles and the disenfranchised that they've had there, and so making sure that we bring up some of those obstacles and make sure that we acknowledge what their life circumstances are and advocate for opportunities and things that really focus on their needs in order to improve and make sure their lives are long and healthy. That connection needs to be there so that our systems and policymakers understand the importance of what they're doing around them and how those policies that they're implementing or those infrastructures that they're creating, how they're actually affecting the lives of the local residents. And for us in East Salinas, we see a lot of need, obviously, and so we are out there trying to improve those outcomes for them. So the health and health policies aligns exactly with the work we are trying to do. So that's why it's important for the East Salinas community to make sure that they have a voice in this and the residents are taking account when these policies are being made and implemented.
I see. So it's kind of like you guys, Building Healthy Communities, really empowered the East Salinas community specifically with a voice. And I see you as really a conduit, as Krista was mentioning earlier, sort of a feedback loop, an ongoing feedback loop between the community members and policymakers.
Right. So we believe that it's really important to have residents at the table. So all these policies are being made with the hopes that they're going to serve the right people and the residents, but really we're not going to know what is accurate or not unless we have residents at the table with policymakers. And so that's what really all this initiative is about and how we come into play, because again, those policies at the end of the day are going to be affecting those people who live in that community. So bringing them to the table, giving them the opportunity to have those conversations and voice their opinions or concerns is why we believe in this model and why we're at the table.
Wonderful. So I've heard health happens here, and I hear that on KZU, our local public radio station. It's a California Endowment kind of slogan. What does that mean?
So health happens here means that health happens everywhere, all around us. Health doesn't just happen when you're ill and you end up in the emergency room or when you end up in the doctor's office. Health happens in your neighborhood. If you have a lot of green spaces and parks to play in, then you're more likely to go out and be active and engage in physical activity versus if you don't have access to those safe spaces. So Health happens in schools. If you have you attend a school where you feel valued and you feel that they're there to really help you and are supportive, you're going to want to go to school, and you're going to want to be more present and be able to learn and go about your daily activities more comfortable. So health happens here just means health is really all around us, and it's focused around the root causes. Health happens in everything we do, right? It all ties back to you being healthy, and your well-being means that you have all the basic needs, that everything around you is being met. And so if you don't feel safe, you're going to be inside your home, not wanting to go outside and engage in that physical activity. So,
right, and like participate in the greater community.
Right, so that's what it's really all about.
I see. So what are Building Healthy Communities' goals and outcomes? And how is it important to anchor health across all systems in trying to achieve these goals and outcomes?
So really our ultimate goals is to improve the health and well-being of residents, and particularly, again, East Salinas residents, but all residents of California. And it's really important to anchor around the health and policies work, because, again, these policies are going to impact the lives of these residents. And so if we're not looking at how these policies are affecting their lives, then what is it are we really trying to are we providing the right services, or are there something else that we could be doing that would help attain a better outcome? And so we're really looking at the underlying cause of those issues and pushing for systems change, so that, again, our systems and our policymakers can really look at what is it that our communities really need and our residents. And the only way that they're going to know that is by having the residents speak up and say, yes, this service is helping, or, no, we need more parks, or we need more lights, so that we can be comfortable going out there on the streets and playing a game of soccer or whatever it is. But that's really, it's about addressing the underlying root cause.
I see. And what are you doing, what is Building Healthy Communities doing to help bring awareness to the importance of health and all policies and the importance of identifying the root causes?
So some of the things that we're doing is starting the conversation, helping the Monterey County Health Department start those conversations. So convening folks to come to the table and just start talking about why is it important to really anchor this work around health. There may be some systems that have never looked at health as critical to their work. Mm-hmm. So, for example, maybe the city never really focused on, okay, how are we really affecting, these residents' health or whatnot. And so we're really helping to make that space available to bring people to the table, everyone from residents to community organizers to systems leaders, to doctors, et cetera, to really start having the conversation of, like, what can we do better, and what is working, but what can be improved. So that's one way where we're helping. We're also helping connect some of the local folks who are working on this to other sites that are already implementing this. So, for example, we just had a convening in Richmond when we brought all these policy people and systems leaders, city managers, residents, et cetera, to the table to really engage in a learning exchange to see how they're implementing this policy or this way of thinking into their city, and what we could do to begin implementing it here in Monterey County.
So you're also kind of taking part, you are taking part in the first phase that Erica just mentioned, the learning kind of information gathering, connecting the dots, if you will.
Correct, because this is a new concept in our county, or a newer concept, and we're beginning in the implementation phase. Well, we're starting to begin the conversations to hopefully start beginning the actual implementation soon. So, it's about getting people to understand what it means and the importance of it, and that's why we're here at the table. And so,
kind of quick question off the cuff here. What are you seeing when policymakers and residents convene? How's that like?
It's really interesting because you realize that they've known this all along. They just never thought about it.
Who, both groups?
Well, mainly residents, because I think sometimes systems leaders get caught up in their day-to-day work that we just forget about how our job actually affects other people or other people who are, living in the infrastructure that we're building. So, but residents will say it, but without necessarily understanding that that's what they mean. So they'll say things like, I think somebody mentioned it earlier, we need better transportation so that I can get to my doctor's appointment. I need more lighting in the park so that I could take my family out there. I need to be able to afford to put my kid on a soccer team so that he can get physical activity and join a team, etc. So they know that it's there. It's one of their needs, but they just don't know it in this health and all policies framework.
And the policymakers?
So the conversations are really interesting because then the policymakers actually understand it.
Interesting.
So they're getting it. They're saying, oh yeah, well it makes sense. So I think it's really neat to just bring them together and get them engaged in that conversation. But you find that it's something that they have already been thinking about. They just never actually had that chance to start talking about it and see what resources they could really pull from to actually begin making it happen.
I see. I don't know why I envision, somewhat of like a food fight or something in these meetings. No, we disagree. But it's not.
You'd be surprised because, really at the end of the day, policymakers are there
to help
the residents of their community. So really, how are you going to disagree with saying, okay, well, we want a safe area where their kids can come out? You really can't disagree with it. So I think it's just about opening that door to have conversation about it.
And that's so nice to hear. The collaboration is truly collaborative.
Right. It's important.
So what is why is it critical that residents understand the importance of health in all policies and help advocate for it themselves too?
Well, it's important because, again, these policies that systems leaders and policymakers are making are there to affect their lives, either positively or negatively, right? We hope that usually it's for a positive reason, but sometimes they have negative implications, which isn't the reason why the policy was adopted, but unfortunately sometimes it comes with it. So it's really, residents have to understand that their voices need to be there at the table and that they have to address and voice those concerns, because if they don't, then nobody's ever going to hear about it. And we systems leaders and folks are going to continue doing things the same way we've been doing them, because we think that it's working. And so unless we have residents who really understand what policies mean and how they affect them and voice those concerns, it's going to continue being the same old, and we're going to think we're doing everything right, but at the end of the day, we may not necessarily be doing the best for them.
I see. So they need to know that they have a voice. And we have just another minute here for a quick question. Why should people get involved in building healthy communities, and how can they get involved?
So people should get involved because, again, it's for your community. It's about your community, and we're listening to what's going on and the needs of the community and how we can do things better. So we are helping to start those conversations and, again, get the residents' voices heard in these very important meetings or whatnot. And how can they get involved? We have community-wide meetings. There's a town hall around ACA coming up soon. And so folks should visit our website or be on the lookout for flyers around that. We're here to provide any support to residents who really want to voice a concern or an issue or want a better understanding of certain something. So it really is about the people, and they should find a way to get involved. There's plenty of ways, so please visit our website or find us on Facebook.
Great. Thank you, Carmen. If you would like to know more about how you can get involved with building healthy communities, visit them online at bhccalconnect.org. That's bhccalconnect.org. Or hit them up on Facebook, East Salinas BHC on Facebook. That's East Salinas BHC on Facebook. Carmen, thank you again for participating.
Thank you for having us.
Indeed, you've really provided some great opportunities for our viewers to become more involved in this really progressive movement towards just improved health for everyone. I also would like to offer a final thank you to our previous guests, Dr. Krista Haney and Ms. Erica Padilla-Chavez from the Monterey County Health Department. Thank you, ladies, for a very inspiring program today. I also want to thank our audience for spending this time with us today. Thank you, viewers. We certainly hope to see you again next month. And if you're finding it hard to wait that long, wait no further. Check us out on YouTube. Yes, that's right. We have established our very own channel on YouTube, for which you can enjoy Your Health television program on demand. Go to YouTube and search for Your Health TV by MCHD. Again, that's Your Health TV by MCHD on YouTube. I'm Emily Sciolto from the Monterey County Health Department, and I've been your host today. Please stay tuned for Your Town television program coming up next, and we'll see you next time.